Good morning. This is Reverend Brown, interim pastor of the Galilee Baptist Church in Roxbrough, 459 Roxbrough Avenue. This morning we are here with Mr. Donald Burton for our Medicare workshop as a part of our health and wellness for the community. And at this time we present to you Mr. Donald Burton.
Good morning. Good morning, and thank you for that introduction, Richard. My name is Donald Burton. To tell you a little bit about myself, I am a Medicare broker for the last 11 years. I represent 9 different states. Part of my goal is to educate people about Medicare. So today I'm presenting a Medicare 101 presentation to explain what the A, B, C, and D's are, because a lot of folks get that confused. They don't always know what they stand for. So I'm going to do a slight slide today, and as I mentioned, I represent over 13 plans in New Jersey, Pennsylvania, Delaware, New York, Virginia, North Carolina, Florida, Georgia, and Pennsylvania. And basically what we're going to do today, once I finish the presentation, we'll have a Q&A. Because if you have any questions, I'm going to do my best to answer them for you. Okay? So, as we move further, when it comes to enrollment, most people are familiar when they become eligible for Medicare in enrolling in Part A. So Part A means that you work a minimum of at least 10 years or 40 quarters in your lifetime, and you qualify for Part A. Part A covers your hospitalization. Okay. Part B covers your doctors, your primary doctors, your specialists, and things of that nature. But you have to enroll in Part B. Most people don't know when to enroll, however. So if you're currently working for an employer and you're on an employer's plan and you're eligible for Medicare, you don't have to enroll in Part B if you're on the employer's health plan. So if you ever left the employer or you retired, unless it's the county, the state, or government position, they may not offer you a retirement plan. And because of that, they'll say, okay, you're retiring on such and such date. Here's the date where your Medicare plan, or excuse me, your health plan with the company you work for is going to end. And when that happens, then you have the option to enroll in what they call Medicare. Medicare A and B, which is original Medicare. Now, most people don't know with original Medicare, it's an 80-20 plan. So that means that CMS, Center for Medicare Services, are going to cover 80% of your health services. 20% is going to be your responsibility. And they call it original Medicare. And what I'll show you real quick is what I'm talking about. Those of us that are on Medicare, we have this. Okay? And it's going to tell you A covers your hospital, and B covers your medical, and this is an 80-20 plan. So, people have always asked, if I wanted to get more coverage other than just having an original Medicare, what can I do? So, there are options. And pretty soon, October 15th, you're going to find that you're going to be inundated with commercials.
And telephone calls.
From every carrier you can think of.
Yes.
They're going to run daily for the next 7 weeks, from October 15th, which is called annual enrollment period, all the way to December 7th. In that period of time, if you're just turning 65, you can enroll in what they call the Medicare Advantage plan. And it's designed to also help with the 20% that you may find is your cost. Medicare Advantage plans, however, do have co-pays, co-insurances, and deductibles. Now, there's also another option, and some people know them as what they call med subs or supplements. Supplements operate opposite of a medical advantage. Most plans eliminate your co-pays, co-insurances, and deductibles. So it really depends on where you are in terms of your health needs. So if I'm coming from an employer and I'm looking at either a medical advantage or supplement, whichever ones I decide to select, 9 times out of 10 is going to be my health concerns or my health needs, or how do I feel, if I'm healthy, if I'm not, if I have any concerns about any other issues such as cancer in the family, things of that, anything hereditary, I may consider going with a supplemental, because a supplemental will cover you for all your medical. However, unlike a medical advantage, it does as well, but the supplemental has a premium. So if I'm 65, or whatever age I'm at, it's going to be based on my age. Once I leave the employer, I have what they call guarantee issue, which means I cannot be denied, whatever my health condition is, to be on a supplemental. The medical advantage plan has no restrictions. So no matter what your health concerns or where your health is at, you automatically will be accepted with the medical advantage if you have the A and B Medicare card, and it doesn't matter what your health is. They can't deny you. So I've had clients who ask me, after they've been on a medical advantage for 5 years, so from 65 to 70, they realize, you know what? I like to get on that supplement because I have a lot of issues. I have to see specialists all the time. And on a medical advantage plan, 9 times out of 10, there is a copay or a co-insurance or a deductible that I have to be responsible for. So the difference is, if 5 years has passed, we can look at a supplemental, but you will be what they call graded on what your current health condition is. So they'll go to the MIB, the Medical Information Bureau, and they may say, well, because of this and that, we can't put you on a supplement. Or they may say, because you are in great health, we can. But it's always going to be a premium with that. With the medical advantage plans, there are no premiums in a lot of the plans. You may say 0 per plan, okay? Now, the one thing you must continue to do in order to stay on any Medicare plan, whether it's a supplement or medical advantage, you have to continue to pay the Part B. So the Part B is part of your original Medicare. Once you continue to pay that, either coming out of your Social Security or coming out from your bank account or from wherever you deem to pay it, you're fine, okay? If you happen to be under the poverty level, okay, the state will pick it up. Call it PART, they call it low income subsidy, or either Medicaid. And they'll pay that Part B for you if you fall into that category, all right? So basically, people who are under 65 and disabled do qualify for Medicare, but you gotta be on Medicaid for at least 24 months. So if you're born disabled, 2 years later or whatever, you automatically qualify. If you are 65 and older, you automatically qualify, okay? As long as you have worked 10 years or 40 quarters. So the A covers your hospitalization, the B covers your doctors, preventive, diagnostics, your blood work, things of that nature. The C is what they call the Medicare Advantage. So people say, what's a C plan? That's a Medicare Advantage plan. And it also covers your Part D, which is prescriptions. So it's all in one. So you got your A, hospitalization, you got your B, doctors, you got your C, which is an Advantage plan, and you have your D all in one. Now, I did touch on the Medigap supplements. Those are all individual health plans. So if you got a supplement, it's the supplement, which is going to cover all your medical needs. However, it's an a la carte plan, which means if you needed anything extra, like dental, vision, hearing, things of that nature, you have to have a separate plan to go along with that. So not only will you have the supplement, you have the premium, you're paying your Part B, you have your Part D, you have to have, whether you take any medication at all, okay? If you happen to not enroll in D, and it's more than 63 days, you will get a notice from IRMA saying that you owe a penalty. This penalty is assessed at 1% for every month, for every year, you do not have a prescription drug plan. Even if you don't take one prescription.
Wow.
Okay? And most people don't know that. There's some people who are very healthy when they become eligible for Medicare and they say, well, I don't take any medicine. Why should I get a prescription drug plan? Well, the government says everybody has to get a prescription drug plan. Because if not, what will happen is you be assessed. Hello, how are you?
Hi.
All right, good morning and welcome.
All right.
All right, good morning. All right, the cavalry is here. All right. We're going to pick little boys here. We should do that a little later. We'll put it on this side. There you go.
Good morning. Good morning. How are you?
Okay.
Good.
Yes. So with the late enrollment penalty, I've had several of my clients over the years, and even some of the new ones said, I got this letter here. They're telling me I have a penalty. And the only reason that you got that letter is that at some point you may have not had a prescription drug plan by not having it with the employer, or you just saw original Medicare. So when you get this, most people say, okay, I got Medicare. You're fine. But now you got to get a prescription drug plan to go with this if it's going to be separate. Stand alone. If it's a supplement, you'll get a supplement. You have this. These are the two pieces you have to show your doctor. If you need prescription drugs, you have to have a standalone prescription drug. If you need vision, you got to have standalone vision. If you need dental, standalone dental. Hearing, standalone. So you get the picture. Everything's standalone. With the Part C, here, the medical advantage is it's all in one. So you get the hospitalization, you get your doctors, you get some vision, you get some dental, you get some hearing, you may get some transportation, you may get healthy foods, you may get over the counter. But it's all, and you're gonna get drugs, all in one. So it depends on which plans you select that best fits your needs. And that's all in a medical advantage plan. Now, if you just stay on this alone, for those of you who came in a little later, this is an 80-20 plan by itself, which means Center for Medicare Services is only going to cover 80% of all of your health needs. 20% will be left to you, which means it comes out of your pocket. So this is why people are, and you see these commercials, as I pointed out a little earlier, starting in October 15th, you're going to see every carrier that's popping across your screen all times of the day, trying to get you to sign up with their plan. Do you have a question?
Yes, so this Medicare would cover everything instead of getting other supplement?
Correct. This is, put it to you like this. If I took you to McDonald's this morning and I asked you, what would you like? What would you say to me? Do you go to McDonald's?
You go to Wendy's.
Okay, Wendy's. That works.
$100 breakfast sandwich.
Okay, that's just a breakfast sandwich. Would you want coffee with that and a hash brown?
Yes, please.
So that's the value. That's the value meal. That's a medical advantage plan.
All this other Medicare.
That's a Part C.
That's it.
Now, if you said to me you just wanted the breakfast sandwich and then you want a Danish and you want a shake, You have to pay for each one separately,
Separate.
a la carte.
Yeah.
That's the supplement. So you may have heard of Plan A and Plan G,
Yeah.
Plan C, Plan F.
Oh.
Plans, anytime you hear plan, it's a supplement.
Okay.
When you hear part, it's a medical advantage.
Ah.
Because if you look at the bottom of your Medicare card, the easiest way to remember that is that these say Part A and Part B. Medical Advantage is Part C, and Part D is always your drugs.
Yeah.
Okay, so that's the difference between the two options you have. Okay? Go ahead, I'm sorry.
But so would D be included too?
It'd be included too. It's all in one. It's like a value meal.
Okay.
Okay? And, yes, sir.
On that question.
Okay.
Oh,
Sorry.
my question is, what's the advantage to going with the Part C rather than doing the a la carte or the one at a time, Part A, Part B? Why would somebody choose
Okay.
why wouldn't everybody just choose the C?
A good point.
Question.
Good point. So, just say I have a history of cancer in my family, or I have a history of some type of health issue that I'm concerned about when I get a little older. I may weigh the two because the supplement, I pay one premium, which can be, if you're 65, it's averaging about $135 a month, okay? Plus you have to pay your Part B, which is another $185. Then you gotta get a standalone drug plan that could be anywhere from $9 to $100. And then if I want vision, hearing, and all the other stuff, they keep adding. Now, Medical Advantage, I can offer you one for 0 premium a month. You still gotta pay your Part B, but I'm going to include the vision, the hearing, the dental, transportation, over the counter. I can buy my vitamins and my drugs, all types of other benefits. But here's the difference. If I'm healthy, I got my health under control. So in other words, if I got high blood pressure and I'm diabetic, not a type 2, but a type 1, I may go to a specialist maybe twice a year. My primary care, if I go on a Medical Advantage, would be 0. So it doesn't cost me to get my checkups. All my preventive is covered, things of that nature. If I'm healthy, a Medical Advantage works well. But if I'm not, and I got 5 specialists or 4 specialists I have to see every 3 months, with the Medical Advantage plan, depending on the plan you select, the specialist fee can be as low as $5 or high as $50. So if I happen to get on a plan and every time I look at it and say I gotta go see a specialist 3 times every 3 months, that's $150. So I got to see 3 of them, 50, 50, 50. Okay, but if my health warrants it and they cover everything else, then a supplement would be more attractive because I'll just pay the $150 for the entire month. And I can see as many doctors as I want. I can go to any doctor I want to go, as long as they take this.
Okay.
You're not restricted. With a Medical Advantage, you are, because they're networks. So how many of you have heard of HMOs? Okay, anybody know what an HMO stands for?
Health maintenance organization.
Correct. How about PPO? That's the preferred provider organization. The difference between the 2 types of plans is this. If I select an HMO plan, which are very popular, by the way, in most inner cities, and I'll tell you why. Because it takes 20 blocks to hit a mile in the city. I'm in New Jersey. A mile, it may take me 10 miles, never mind the blocks. But an HMO may not be to my advantage. Because if I'm in the city, I'm maintenance, health maintenance, which means I stay in network. If I go out of network, I'm getting hit with 100% of that bill. With the PPO, I can also stay in network. I can also go out of network. And just say my specialist fee is $20 in network. It may be 30 or 40 out of network. So it doesn't restrict me if I want to see a different specialist,
You just pay.
other than the HMO offer. I may say, well, you know what, I don't like this specialist, I need to get a second or third opinion. I'm going outside the network, I'll pay the extra money, and I'm okay with that. So that's the difference between the two. The supplementals have no networks. You can see any doctor. And HMOs, you need referrals. How many of you had the opportunity, if you had an HMO, you had to get a referral from your primary care. So that means you got to go make an appointment with your primary care, which we know the appointments can be very difficult, and time, just to get a referral to go see this cardiologist. So not only you're paying for that if it's not zeroed out, you're paying that, plus you got to pay the specialist fee. So does that make sense?
Is this like Kaiser versus like regular insurance? The same idea?
Yeah. So Kaiser is another private insurer. So the Kaiser, United Healthcare, Cigna,
Humana.
you name it.
Yeah.
Just name the carrier. They contracted with the Center for Medicare Services and say, well, because there's 10,000 people a day turning 65 or going on to Medicare, we want to connect. We're going to offer them a plan to help them eliminate most of that 20%. But other than that, we're going to give them a little bit of this, a little bit of this, a little bit of this. Doesn't matter if it's Kaiser, United Health, they all have their own plan design. And that's why every year you have the option to have someone that, if you know anyone, like Richard knows me, to say, hey, look, can you look at my plan this year, see if any changes has happened or anything else out there that I may be more beneficial to me this year? Or if it's not broke, we don't fix it. But you have the option every year to look at your medical advantage plan and change it. Okay? So you may get a call from a friend and say, girl, I'm on this plan, I'm with Highmark, and I'm getting this, I'm getting that, and I'm getting this. Now the difference is, these plans are all based on your zip codes.
Zip code, that's right.
So depending on what your zip code here in Philadelphia is, may depend on the plan design. It could be the same company, it could be Humana, just the name of the company, but in 0919 whatever, and 0900 whatever, could be two different plans that Humana is offering. And what I mean by that is the plan design.
So, whoa. So, if you have two individuals on Humana, and one lives in South Philly and one lives in the greater Northeast, but they still live within the 191 proper.
That's fine.
But
They
it's-
have two different.
It's driven by the full area code, by what is available in your particular area.
Now,
Like they could get $25 over the counter. Northeast might get $75.
That's
over the
where I'm.
counter.
That is
the
correct.
difference. That's the difference.
That is correct. So if you think about how they map the communities, it's
That's
all based
exactly right.
on income.
It's terrible income.
Okay, the lower the income, you may find that same plan gives you more.
That's why you have to compare the plans during that time. And that's what we do.
Right. We kind of go review. In other words, if my clients start to call me, hey Donald, I need to look at the new plan. Can you tell me what I got? Any changes that happen? Because you'll know there's going to be changes also, because they send out what they call an ANOC letter. It's called Annual Notice of Change. They have to, by law, let you know, Humana, this year, we're eliminating your dental from $2,000 benefit down to $1,000. You need to know that. Because if you're thinking of $2,000 and you're planning for the new year to go to your dentist with the $2,000 benefit, and the dentist said, well, you only got $1,000, where do you think the other $1,000 is going to come from? Yeah.
But all the plans do this.
Yes,
All
of them.
So
Now, some don't change, or they may change for the better. They may give you a little bit more this time. See, it depends. But you will get a notification.
I am stuck on the zip code.
I know.
No, but
I know.
that's, and that's across the board.
Yeah.
That's
That's across the board.
everywhere in the United States.
That's correct. Hello, how you doing, dear? So I go to Oak Street in Strawberry Mansion. I go to Oak Street in Cobbs Creek.
Yeah.
I'm also going to go to Oak Street this year in Germantown, Norristown, and Cheltenham. Now, I may represent that same company in each one of those towns, but the plan design may be slightly different from Germantown to say Norristown. See?
Or even Cheltenham
Or Cheltenham.
to Cheltenham to Chestnut Hill. Two
So-
different area codes. Two different
So
things.
not to knock it entirely, you still may have a very good plan.
You may have a better plan than the person down in South.
And you may not want to change the plan. You don't have to. Okay? You can say, you know what? My plan's good. I'm good. Or I like to get this. So here's what I advise a lot of my beneficiaries to do. If you, for instance, whatever plan you selected, we go over the benefit. First of all, we go over your doctors. Number one. Number two is your prescriptions. Okay? The doctors and the prescriptions are the two most important elements that we can do for you, because I want to make sure that whatever plan you're being offered, they also accept it in network, if it's a Medicare Advantage plan. Okay? With a supplement, it doesn't matter because you can go to any doctor. You don't have to be in a network. So I always go through that first. Now we got that straight. We're gonna pick 3 plans in your zip code, and we're gonna compare them with what you have already, and then show you if any differences. And I go line by line to explain the benefits. What's an in-network stay in the hospital? In-network stays, if you go into the hospital, you're gonna pay so much a day. Okay? What's an outpatient? You're gonna pay so much as a copay. Outpatient may consist of a mammogram, a colonoscopy, shoulder surgery, knee surgery, whatever. You need to know where I can go and obviously get that taken care of. So we go through all of that just to make sure you understand it. This way you know what you have in your plan. And I'll explain it this way. For many years, I worked for different companies. And I raised 3 children and all that kind of stuff. I always had health insurance. And every year I would go to the open enrollment. You may get that at your job, you may get that at your job. We need you to look at your health plan this year because we're making some changes. Or we may change the carrier from Aetna to United Healthcare. What we don't do a lot of times, as we're young and coming up and we still, have our health insurance, we don't always examine the benefits. Because for one, we can't change them anyway. It's up to the company. But if anything comes up, all of a sudden, you need knee surgery. All of a sudden, you look at your plan, wait a minute, what is that? Let me see, how much I got to pay for that? What are you going to do? You're going to look at your, oh, wow, I didn't know that was $500 outpatient fee for me to do that. So we get in the habit of not looking at these plans when we get them from the employer, unless you have health challenges and issues that you need to address. But a lot of times, we don't know what we need if you're healthy until that happens. You got great teeth. All of a sudden, boom, you need a root canal. And it's, yes, sir.
And that's when I use the magnifying glass.
There you go.
They
There you
didn't
go.
tell me I needed a bit.
Right.
The mapping, you said that's a nationwide thing. I have a question about how that works. So if I live in Logan, right, and let's say, I need care, I need doctors, something happens, but I want to get to, the specialist that performs out of like Valley Kenwood.
Okay.
I live in Logan.
Okay.
I have insurance. They want to supply me just doctors that are in the Logan area. So, my care is going to be Einstein. But what if I'm like, I don't want to go to Einstein. I want to go get my care in Valley Kenwood.
Okay.
They're not going to allow that because they're going to suggest all of my doctors be close to where I live. Is that correct?
Only if you're in an HMO,
Okay.
a health maintenance organization.
Uh-huh.
Because otherwise you can go,
Mhm.
but you're going to get a bill.
Right,
100% because you
Right.
went out of network.
So if you're in an HMO, they're going to force you to go to the doctors that are
Correct.
In
Because
the
they can
network,
manage
that's right.
the level of care and cost.
Right. But if I want better care because I'm like, I don't like the care at Einstein or I don't want
That's
the
why
care
you
at
get
rehab
the,
center.
So you may
I'm
want
gonna
to
have to pay out
consider
of pocket.
Right, you may want to consider either a supplemental, Medigap, MedSup, or a PPO, or an HMO POS.
Yes.
HMO POS is called point of sale. That acts like a PPO, and they're huge in the inner cities because of that same very thing you just mentioned. You may want to go to another hospital. Now, these hospitals are also in a network. A lot of these doctors are connected to the hospitals. So, you know, you have several options on how you want to work that. But if you're in a PPO, you may go to an out-of-network hospital, and that out-of-network hospital may cost you X amount of dollars. If you went to an in-network hospital, it may cost you $0. So you have to look at where you go. Now, sometimes we can't control where we go.
Right.
If emergency pop up and you're on the other side of town, 9 times out of 10, get me to the quickest.
Right.
Get me to the hospital. It's emergency. I don't care which hospital I go.
That's perfect.
Get me there.
Okay.
You'll worry about all that later. But if you're in a PPO, again, you may pay a little bit more extra. But a very good question, because and we don't control it. It's done by these insurance companies and the Center for Medicare Services. Now, October 1st, every year, what's happening is that the new plans for the medical advantages will start to come out with what CMS approved them for. So we can't talk about 2026 plans until after October 1st. By that time, you also, if you already have one, you're going to get that ANOC letter, that annual notice of change. So as soon as you get it, you go, oh my, and by the way, they come in multi-colors. They may come in pink, purple, green. So the whole idea with that is so people don't throw them away. But I don't know about you, if I see a multicolored paper coming in the mail, I may tend to think it's junk mail and shred it or throw it away. But that's your annual notice of change. Okay, so does anybody else have any other questions pertaining to that? Yeah, as soon as my TV comes back on.
I know Rosie got one. It's
Put that on
about
hold,
out of her.
Yeah, you were talking about the Medicare Advantage.
Yes.
How much does that cost? Like, I have United Healthcare.
Okay.
I know how much mine is a month.
Okay.
How much the medical, other one you tell me about, how much does that cost?
The medical sub. So the medical sub is going to depend on 2 factors. I would say more than 2 factors. Reese, can you put that back on for me, please? Age. Okay. The medical sub will depend on your age and your health.
Yeah, okay.
Okay? So, if you're healthy and you're already in a med sub plan, and say you started it out at 65, by the time you turn 70, it jumped from 150 to 300. Because that happens. Because we're getting older.
Like life insurance.
Similar. Very similar. So, you get to the point you say, oh my God, this premium just jumped. But I'm 70 now. I want to get out of this. Can you find me a cheaper supplemental plan? Sure, we can look at that. So, but the difference is, there's going to be about 20 questions. The minimum maybe 10 about your health. Any check off you say yes, it goes to the MIB Bureau, Medical Information Bureau. They look and say, oh, okay, this is why you went in. Now, we can either accept you and raise it even higher, or we can deny you. You have to stay on that supplemental plan. Okay, but your age is going to determine what is going to start out in the beginning. Like most people who turn 65, it's about $135 a month with most of the plans. Now the difference with the supplements too, by law, they have to give you the same benefits. The difference is what they charge you for it. So just to name a carrier, somebody mentioned, I think, United Healthcare. How many of you recall those who are at that, when you turn 50, you know, some of you just barely over that. So when you turn 50, how many remember the AARP card?
Yeah.
The membership. Anybody familiar with that?
Yeah.
Okay, so it was smart marketing.
You should get yourself.
So get us some. And it was smart marketing. And how many of you know why you got that? Okay. Okay, that's good. You turned 50. Anybody else have a reason why you think you got that? Anybody here background in marketing? Okay. So marketing is this. Let's send you a card at 50. We're going to give you discounts on hotels, discounts on dinner, discounts on travel, movie if you use our card. So you're 50. When do you turn 65?
15 years.
15 years, you already got United Healthcare in your head when it gets to this point.
Because it's AARP.
You said, wait a minute. Oh, I know AARP, United Healthcare. That's the one I want. Name recognition. So, doesn't mean it's going to be the best plan. It doesn't mean it's going to be the least expensive.
Right.
It doesn't mean they're going to give you benefits that nobody else matches. It's just that you got it in your head.
They're reliable. I'm
That's
used
right.
to them.
That's right. It's brand name.
I'm
Brand
familiar.
name.
I'm feeling
Aetna, another one. But Aetna does it from the employer side. Most employers have Aetna as their plan of choice for the group plan. And those are group plans. These are individual plans. So if you ever left the group, you step into the individual world. And that's why all these other companies are starting to say, hey, look at our plan. We can give you this, we can give you that, we can give you this, we can give you that. You're going to get calls inundating you. Hey, I can switch you up. I can give you healthy foods. I can give you this, I can give you that. What they don't do is check your doctors. They don't check your medication. Okay? They may say, hey, sounds good. Anything going to change? No, nothing's going to change. All of a sudden, you're getting a new card in the mail. What is this? Oh, I got a new card. Then you go to your doctors with a new card. They say, we don't take that. Now what do? You're kind of in a situation now, you gave up something to get something else. And I always associate it to a story I used to tell about the feeble mind. Not that any of us are feeble-minded, but there's a story about a fisherman and his dog. And they used to get on the lake and go fishing. So one day he gave his dog a nice bone, a nice rib bone. And they out there, they fishing, and he's reeling them in. All of a sudden, the dog has a bone in his mouth. He looks over the boat, and he sees the reflection of the bone. And he got this big, and he dropped the bone because he thought he had a bigger bone than the one he had in his mouth. So sometimes we think we have benefits. Somebody has more benefits, so I got a better plan if I go this way and that way. In fact, you have what you need. So therefore, you got to be careful when you get these calls to come in, especially if you're Medicare eligible, because they're going to constantly hit you with trying to get you to switch. The other part of that is that most people only represent one plan.
One plan.
The difference between an agent and a broker, I'm a broker, so I represent many. Although I don't represent them all. I make that point clear. Not in every state, not in every zip code. I do not represent them all. Okay? So those who have an agent, they represent one. They cannot talk about this plan, that plan, this plan. Why would they? Because if they told you their benefits compared to their benefits, you may say, you know what? I don't want your plan. Give me that other plan. But they can't do it if they only represent one. So this is the medical advantage world, where once you are in that space, you'll be dealing with. Okay? So anybody else have any other questions? Yes, sir.
Outside of turning 65, is it income based? Like, do I have to qualify based on my income for Medicare?
No. You qualify in a couple of ways. You're either under 65 and disabled, you are 65, okay? But you also have to have a minimum of 10 years of 40 quarters work in your lifetime. that qualifies you for Part A only. So as long as you have that, now you have people who are immigrants who may have been here for 8 years. And they say, oh, I want Medicare. Can't get it. Or you can pay $500 something a month for the next 2 years to qualify.
What if you're self-employed?
Same difference. If you as long as you pay in your here's the thing. In your pay stubs, if you work for an employer, there are 5 basic things that come out. State, federal, disability, unemployment, and Social Security. And as long as it's being taken out, they record it. And when it's that time, they're going to say, okay, for the last 20 years, you made this, and that. Now, what determines how much you're going to bring home when you retire is to determine your 10 highest earning income years. And then they have a formula, and this is what you come out with. So some people may have 2,500, some may have 1,000, some may have 5,000 a month. Really depends on where your income fell over the years, if that makes sense. All right. So, I pretty much did most of the presentation by just questions and answers, which is also another good thing. However, let me get through this. Have the red, white, and blue card, they don't cover all these extras. All right? Let me see here. Now, it's perfectly okay to keep this if this is all you want. But remember, you still got to get a prescription drug plan, even if you don't take one prescription, because you will get hit with a penalty for the rest of your life. Okay? They have programs. How many of you have prescription drug plans now? Or you have prescriptions that you must fill every month? Just about everybody in the room, right?
A whole bunch.
Okay. So,
Too many.
show of hands, how many of you are Medicare and you have a Part C plan? Like the Advantage, medical Advantage.
Plan with that.
You have that, covers your drugs?
I have another plan with that. I don't have all.
Okay, so you have a supplemental.
Yes, yes.
Got it. Do you have a prescription drug plan?
Yes.
Okay, good. Mom?
Yeah, I have prescriptions.
I still work too. But I still
Correct.
have that in my health plan still continues.
Through your employer?
Right, through my employer. Still comes from my wife too.
Absolutely, because she's covered.
Right.
Now, if you ever left the employer, just to give an example,
Hey.
well, now you got to pay, she got to get her own plan.
Yeah.
Because she can't go on the Medicare plan like you.
Right.
This is all for individuals. So keep that in mind as well. I've been married 43 years. My wife was on my plan all these years
Yeah.
until I got on Medicare. Well, she got on before me because she had a disability.
Okay.
So she had to come off my plan at the time. But if she was still on my employer's plan and I came into Medicare first, I had to say, nay, you gotta get your own plan. They won't let me bring you on this. So these are little things that we don't find out until that time comes, unfortunately. But like I said, now,
If you, excuse me,
I'm sorry.
if you have Medicare and you have an employer plan, the employer plan is primary?
yes. Secondary is gonna be, no, actually it's reversed. Medicare is your primary and secondary is your employer. Because the employer is paying your Part B, by the way, once you become eligible for Medicare. Most people don't know that. See, they'll say, okay, you on our insurance plan, so we're gonna pay your part. Some people get reimbursed, like teachers and government workers, county workers. They may pay it and then get reimbursed from the company because the Part B has to get paid regardless. Even if you're in poverty and you can't pay it, the state pays it for you. So let me ask you a question that I'm not gonna put up any wages, but I'll ask this question. How many of you know which is the largest bank in the country? Take a shot at it.
Chase Manhattan.
Okay. Anybody else?
The largest bank?
in the country?
Jeez. PayPal.
PayPal? Anybody else?
Everybody consider the Federal Reserve. That's
Federal Reserve, I like that, go ahead. All right, so that's good, we got 3. It's the Medicare bank. Yeah, because we constantly pay into it for the rest of our lives.
Yeah.
Everybody. And you get no return other than a
That's
plan.
right.
That 180, I pay 185 a month. Okay? That's because I'm under, what, 299,000? Everybody above that, if you're wealthy, you're not even paying that. That's the
You're
problem with
paying
the wealthy.
more. Yeah.
Wealthy don't pay that. Okay? We pay it.
Wait a minute, you said the wealthy don't pay into Medicare?
They pay one amount over a certain amount that they earn. Otherwise, they wouldn't be crying about the Medicare bank getting empty. If they paid their share, Medicare will run to infinity. But they don't. We, under a certain income level, pay. Although, I still believe that's not going to run out of money. Because they get 185 from me every month. Get from you, anybody who's there.
You too, because you're paying into
I'm
that.
paying into
You're
it.
You're paying into it. And you want it when you retire.
And anybody who gets a job pays Social Security tax.
Right.
So the argument
Above
is,
the books. Above and on the books.
Yeah. So the argument is, someone like yourself, how old are you, about 40, 35?
Oh, I
I'm asking you. Trying to remind my daughter a little
love
bit.
you. 49.
Oh, okay. Well, you're just
You're a baby.
You're gonna get an
You're a baby.
right?
It'll be coming.
So your argument would be, why am I paying something that's not gonna be there in 15 years? And by the way, am I gonna get that back? See, your generation has got to make a lot of noise. Okay, that's why voting is so important. You got to make a lot of noise because these issues are going to affect you, and they're taking it from you now. So these are the things that we don't always think about when we get to the point where we are now. Because I'll be honest with you, 11 years ago, my mom called me up because she worked well into her 70s. And she said, Donald, I need you to help me with this Medicare. And she lives in Florida. I'm like, Medicare? What's Medicare? So the joke is, I was always a life insurance guy when you mentioned life insurance. I was a mutual homeowner. And she says, aren't you an insurance salesman? I said, yeah, but I have no clue what you're talking about with Medicare. So that's when I started to meet some of the seniors and ask them, can you tell me a little bit about Medicare? And I kept getting mixed responses. Oh, I got Medicare, I got Part A, I got Plan G, I got Plan F. Well, what does that mean? And then some knew, but Part A covers your hospitalization, Part B covers your doctors, the C, I have no clue, blah, blah, blah. So it intrigued me to learn more about it. And ironically, I was doing a presentation for Mutual Omaha about 2 weeks later. And I did my presentation, and then I sat down and a gentleman got up and did his. It was on Medicare. I said, man, you're the guy I need to talk to. Come to find out, we're partners to this day. He's a retired police officer out of Penns Grove, New Jersey. And he says, I said, well, how can I do what you do? Because my mom's killing me with these questions. I don't know anything about it. He said, well, if you got your health license, I'll teach you the business. And that's how I started in this. And I'm glad I did, because I just turned 67. Going back 10 years ago, I was 57. I didn't have a clue about what I'm talking about today. And I know that the information is the key to all of us, okay? So, you know, I'm grateful for that. But it's a lot to absorb. So we have to be certified, Reese and I, every year for every plan we represent. So when we talk to you about a plan, we know what we're talking about. We're not giving you misinformation. So, and this is why I know Richard through his sister, and I have senior buildings I go in. I go to here, I do churches, I do Zoom. When COVID was out, I did Zooms, you know, because people had questions like you're having today. But the more you understand it, the easier it is going to be to navigate it. Because I'll be honest with you, I went to school. I'm not a college graduate, but I've learned my way through life. But I'd like to read. When you get to 65, the last thing you're thinking about is after you don't work for 35, 40, 50 years. Yeah, that's right, Reese. 35, 40 years, last thing you want to do is get this book in the mail. That's right. See this? And this, now,
How many of you have read it?
I thought
I'm not gonna lie, I trash.
So I'll be-
That's
That's right.
trash, you keep my
So-
book. I
so-
do keep my book, yeah.
the funny thing about it is, I do like to read, but I read when I'm ready to go to bed because it's a good way to put me to sleep. Especially when I'm reading this stuff after I've been certified. But the good news is every plan in the country is in this book.
Everything's
Every
in that
plan
book.
that we're talking about, medical advantage or supplements, it bless you.
Bless you, honey.
Prescription drugs are in this book. It's just that they give you the basics, but not the whole picture to the plan
Right.
and all that it offers. So even after you've read it, say, well, you know what? I didn't hear anything about over the counter. Yeah, because they didn't put it in here. Because each plan, one plan can offer you $75 a month.
Another plan won't offer you nothing.
Another plan will offer you nothing.
Yeah.
And then they have what they call dual plans. Dual plans, anybody know what a dual plan is?
Medicare, Medicaid,
That's correct.
insurance person.
Oh, so there you go.
Oh, cool.
Excellent. So that's exactly right. If you qualify for Medicaid and Medicare, you have dual plans that are under one umbrella. So Medicare is only going to pay for Medicare services, and Medicaid is only going to pay for Medicaid services. But they coordinate who gets paid under this one plan based on the service that you did. But you get everything for zero. Because what normally would cost you in a regular Medicare Advantage plan, say it's $30 for your specialist, on a dual plan, zero. Because Medicaid picks that up. You may get $300 a month in one plan. Just because you can pay utilities, you can pay your rent, you can pay your light bill, or you can just use it because Medicaid covers that. So when you hear about the Medicaid cuts, that I'm not going to call him Commander-in-Chief, I'm going to call him the destroyer. Everything that's good, okay? Medicaid is on the chopping block. See, and they're not even considering people who are truly disabled, whether it was by birth or age over time. They're not considering that. What they're targeting in is this young man. How old are you, by the way? About 25, 30?
44.
Okay, 44. Okay, you got my daughter's age. Okay.
My
But-
daughter's age.
So they're targeting the young folks who are not employed, who still need health coverage, and Medicaid says we'll cover you. Now, I'm not entirely totally against that unless you're disabled. If you can work or you can find a job, you gotta give them a grace period. You can't just cut them off. Give them 6 months, a year. Find a job and you can stay on it or get off of it. But who's really getting hurt is the seniors. The SNAP, food's going away. People are getting food stamps, they're getting $100. They were getting $300 or $200, now they're getting $50 and $25. It's a joke.
It is.
Meanwhile, you go to the grocery store, you can't buy new items.
You can't buy nothing.
You can't buy nothing. That's right.
That's a ham.
That's a ham. How about that? And that's all you get. No sides. You get no sides. You get no collard greens. No none of that.
Hey, you gotta go to the food bank for
You
that.
gotta go to food bank. Right.
You gotta go to the food bank.
Food bank. Exactly right. And the irony of it is, I see a lot of folk at the food banks. They ain't necessarily us.
Yeah. Yeah.
I see them in the rural communities. They got a line going hey, around the block. I said, what they doing? Oh, they getting food. So these are the things that affect us, and it does affect us as far as our finances, not just our health, but if it's costing you more to have less, it's not benefiting you. So this is why it's important, at least on the health side. My motto is your health is your wealth. At least know that on the health side, you get everything you're entitled to that's costing you least, especially those of us that are in the individual market. If you're working for an employer, you really don't have no control about it. You say, yo, I don't like this plan. Why don't you get this? Because I heard this. You got to get a new job then. We're not changing the plan until next year because they're looking at their bottom line. And all of a sudden they hit you with a premium that you never had before. I've had people say, well, they used to didn't take much of a premium. Now they hit me for $200 every 2 weeks. You're paying in your insurance, not just Medicare. You're paying for the insurance plan. So that's another reason why you can also opt out. If you find it's getting real expensive with the employer plan and you're eligible for Medicare, you need to look at it.
That was me.
Yeah. So anyway, there's a lot of those facets, but like I said, I don't expect seniors to do a lot of reading when you retire, because that's like going back to school and you're not getting paid.
There you go.
The other thing I want to touch on real quick, and I'm probably going to end it on that, is going to be the prescription drugs. So, we all have prescription drug plan, right? Based on, now, most plans offer a 5-tier prescription drugs. So, tier 1 and 2 are generally generics. You know, like your blood pressure, your cholesterol, things like that. They usually don't cost you much, $0, $5, $10, depending on whether you go to an in-network pharmacy or out-of-network pharmacy. It could make the difference of $10 or $0, okay? But the tiers play a big role in what you're paying. So if I'm with a tier 1 and 2, $0 for me in most plans. 3, 4, and 5 is your brand name. So if you get the brand prescription, they're going to cost you $47 to tier 3 for 30-day supply. Then it can go up to $100 for tier 4, and 5 could be catastrophic. Okay? This is where seniors get. But there is some hope for that. So in the state of Pennsylvania, if you have a prescription drug, or you are tier 3, 4, and 5, they have a program called PACE. PACE is like a pharmaceutical assistance for the seniors. Most of you are going to qualify because it's all based on a certain high income. And if it's less than that, you can almost get approved the same day in Pennsylvania. In New Jersey, they call it PAD, P-A-A-D. But that may take 4 months to get approved.
Yeah.
And what PAD does, it makes sure it lowers your prescriptions. So if I'm paying $47 for a tier 3, if I'm on PACE, I'm probably going to get reduced to $3 to $7 for that same prescription. And most of you qualify don't even know it. It doesn't cost you anything. All you got to do is apply for it. We got some forms here.
We gave
Forms
that.
there?
Did you get the PACE form?
I got it.
Yeah.
So that's how you can actually go on and see if you qualify. And if you qualify, why not? They also help pay for certain premiums on certain plans. Like I mentioned United Healthcare. So say they have a 0 premium plan, then they may have a premium plan, maybe $30 a month, but you may get lower out-of-pocket copays. So instead of me paying $20 for my specialist, with that plan, if I'm paying $30 a month, I may pay $5. So if I got a lot of specialists, that may be attractive to me, even though I'm spending the $30. Well, if you got PACE or PAD, they pay the $30.
What if you have deductible with your insurance?
Yeah, they lock them out too. No, some do. Some plans have deductibles, some have a medical deductible, some don't.
Drug deductible.
The drug deductible is a good point because most plans, if you're 3, 4, and 5 tier, the deductible in New Jersey, just to give you an example, is going up to $605 from $590 from last year. So that means you got to pay that first.
Eliminate deductible if you get this?
They'll cover the deductible.
Okay.
They also will cover if you have a late penalty enrollment. Because
Yes.
those are usually for life.
Yeah.
If you get on PACE or PAD or whatever pharmaceutical assistance you have in the state you live across the country, they will say, okay, you on that, we're gonna eliminate that penalty.
We'll pay that for
So these are little things that people don't know either, that's right here in their own state. And it doesn't cost you anything other than just filling out the paperwork. Or make a phone call.
Yeah, for PACE, you can call,
You can call them,
and
and they can almost
file a
approve you the
record
same day. And if they do, they're gonna send you out a little card, then you give it to your pharmacy. So when your pharmacy you come in for your medication, they look, or you give it to the plan you're on, and they'll put it in the system. And when it's time to fill your prescription, that's a 3, 4, 5 tier. They go, oh, you got PACE, okay.
See,
You wipe
Philly
it
has a
down.
good program. Philly
Okay.
has the Department of Aging, and you can call them and find out about a lot of different programs that are available to you too.
That is correct. So these are free benefits that most people don't know, because you know what? No one's gonna knock on your door
I can tell you.
and say, hey, guess what? You can sign up for PACE. You want prescriptions? What's that? Oh, no. But 9 times out of 10, we ain't open the door anyway, because now today is crazy. But even if you got it in the mail, you may not know that this exists. And believe me, I have clients that are paying thousands at one point of prescription cost. And that leads me to this. There's another rule that just came out from the Inflation Reduction Act
Yes.
a year ago when it comes to insulin. The $35 cap, which I had people paying $400 or $500 a month. She knows. She's one. And now they cap it at $35 for a 30-day supply. But besides that, I also had clients that were paying $3,000 and upwards of $4,000, $5,000, $10,000 based on what they needed. 'Cause some of those brand name drugs can be very, very expensive. And if you don't get help from the manufacturer, which you can also do as well, they may give you coupons or reduce that for you and da-da-da-da-da.
And don't forget, some plans do not accept the coupons, so you're still gonna pay the difference.
So you're still gonna pay the difference. So, you know, these, so what they've done is they capped it. What I mean by that is that if I have a client that's spending $2,000 a month, or better yet, $3,000 a month on their prescriptions alone, it's capped at $2,000 maximum. Even if the plan, even if their prescriptions are 3, 4, 5, and 6, 7, and higher. They also have it where you can also join what they call the Medicare premium plan, beginning at the first of the year, January. So in other words, say you was on a plan in January and your medications was $5,000. All you got to do is opt in, and what they'll do is take your $2,000, because that's the most you're going to spend. They're going to divide it into 12 months, which is $166 a month. Lot more, lot better than you have to kick out that first $500, and then you may be on a 6-7 month regimen. You're kicking out $500, and all of a sudden it starts to drop as the year go on. Well, you can avoid that just by opting in to the Medicare premium plan, and you can get out if you want to come out. If you come out, you just got to resume back to your payments you're going to have to pay. But these are little things that are big things because nobody's explaining that, so you even understand it. You get it in the mail. All of your those on Medicare got it. You say, "What is it? I don't know what they're talking about. $2,000. I ain't paid." And some don't even meet that criteria. If you're on all generics, you're never going to hit the $2,000. Okay, it's only for those who have the brand name, the more expensive prescriptions. So these are, like I said earlier, the most important components when I sit down with people is your doctors and your prescriptions. Everything else in the middle comes down to what you need. Like I had a lady 2 days ago, was doing a presentation. I was going to a presentation for Jefferson. Jefferson has a very robust plan in Pennsylvania also. And just as I was about ready to go, I got a call from one of my clients. And she said, I want to thank you. And I says, okay, Gail, how you doing? Everything good? Oh yeah, everything's good. I just came back from the dentist. And the plan that I signed her up for was very strong with dental. And at the time, she was concerned that she needed a lot of dental work. So, long and short, on that particular plan, it was offering $3,500 for cleanings, x-rays, and comprehensive. And she also had what we call a flex card. It's a MasterCard. It had $2,500 on it. So anybody here know math? 35 and 25, right? Now the 25, you can only use it for dental, hearing, or vision. So if she's got 35 for the comprehensive, and then another 25, she got $6,000 she can utilize. The difference was when she went to the dentist, they were out of network. So if they're out of network, the plan says, well, we're not going to give you 100% of the 35. We'll split it down the middle. We'll give you 50%. So that's $1,750. Plus, she says she's sitting in the office because they said, well, this is going to cost you $2,700 because she had it something next to her molar, next to her wisdom tooth. And she said when they started digging, it got worse. And she said, oh my God, what am I going to do with this? And then it hit her. And she's looking through her car. She said, wait a minute, I got the flex card. I remember he told me I got $2,500. She realized that as long as you got MasterCard, and they accept MasterCard, all they did was swipe it. So all she had to do was come out of her pocket with $200. She got all that done.
Thank you, Jesus.
So now, next year, depending on how much work she still needs on her teeth, she can roll into the same plan. Next year, that same plan is giving her $5,000 on the MasterCard, and you don't need a network. Wherever the doctors take MasterCard, you can use that for your dental. If she finds that I don't need dental anymore, but I need more over the counter, or I need give back. So the biggest one I want to explain to you, and I'm going to end it. Give back is when a plan says, we're going to give you back money from your Part B you're paying. So if I'm paying $185 and one of my plans says, oh, if you don't need a lot of dental, you don't need a lot of vision because you got your eyes together, you don't need any hearing, you hear well, we're going to give you back $125 every month, or $140 every month. You say, you know what? I like that one. Also, veterans are a big emphasis this year too, because there are plans for VA veterans. As long as they get their prescriptions from the VA, they can go on a medical advantage plan or a medical advantage only. They have to get their prescriptions from the VA, but they get all the extras. Could be give back, put money back in their pocket. I got one guy, he said, no, I don't need nothing. He said, but you're going to give me back $150 on this plan? I want this plan. It takes about 3 months to, show up because it's coming back from your taking out your Part B. He happy. I talked to him the other day. Say, Lanny, how you doing? He said, you want to change? No, man, I like this. No, they get my money back. He don't need nothing else. So he's happy. So each year you can look at a plan and say, you know what? This year I can use this benefit, and maybe that causes you to change it. So you also have to learn how to work these plans based on what you need as far as your health is concerned. Okay?
But
And it
ladies,
doesn't cost you anything to do that.
let me just say, we love to shop. Let's shop Medicare.
Yeah. Yeah.
I have a question.
Yes.
I'm on 3 medications.
Okay.
High cholesterol, high blood pressure, and what's the other one? I just take
Okay.
3 pills. So
Keeping you healthy.
I'm pretty healthy.
Oh, I can see that. 88.
But-
Yeah, you're healthy.
Yeah. I've been getting my medication from Rite Aid.
Okay.
Okay.
Mhm.
They're gone.
Right.
They're no longer with us.
Right.
So they sent all my prescriptions down to CVS down on Main Street.
Got it.
Well, that's not convenient for me.
Right.
So I told my doctor to switch them up to the Activate because I like to be somewhere close. So for Rite Aid, but for those 3 prescriptions, it was always 0.
Correct.
I never paid anything for them.
Correct.
Rite Aid's charged me.
Correct.
Not that much, but they still charge me.
Correct.
I mean, I'm sorry.
CVS.
Acme.
Acme.
I'm sorry, right. Acme charged me.
Okay.
It was less
That's
than
probably
$3.
not preferred.
It was less than $3 for 2 prescriptions. It wasn't much, but
Right.
the principle of the thing, I hadn't been paying nothing.
$103
It
back.
probably wasn't a preferred pharmacy.
Well, it happens, and
So-
the reach just cities.
It wasn't a preferred pharmacy. You have to
So
look at
what-
your plan and find out what the preferred pharmacy is. Or consider getting mail order and having 90 days delivered each time it's delivered.
So that's a good point.
So I'm
But some,
wondering if they send it to CVS,
Mhm.
would that have been a preferred pharmacy?
Well, it's possible.
Well, you have to look it up. It depends. Or call the
Or
number
call
on
the
the back
number
of
the
your
back of
card
your card
and ask
Okay.
them.
and say, look, what is my preferred pharmacy? Because here's the deal. It's just like the HMO and the PPO. How many remember what I said? If you go out of network with the HMO, how much are you responsible for? 100%. Because you're out of network. You go to a PPO, you're in network. Even if you go out of network, it's not as much. But if you stay in network, it's still zero. You have preferred and standard pharmacies. The preferred pharmacy, so if I'm on United Healthcare, pharmacies, they're saying to me, go to Walgreens, go to Costco, go to CVS. That's your preferred. That's what I'm saying. If that's what they say, I'm going to those 3 because that's when I'm going to pay the less money.
Exactly.
Okay.
That's when I'm going to get a 0. If I decide I don't want to go there, I'm going to say Rite Aid or I'm going somewhere else, they could be standard.
You know, I mean, this just.
That's your money.
Because everybody's just clear.
Right.
Yeah.
That's your money.
So I'm like, wait a minute, what am I getting charged? You know?
Correct.
And don't be afraid to call that number on the back. They
Okay.
work for you. You pay them.
Okay.
So
True.
make sure you call them
True.
and say, look, okay, I got a bill from somebody. Explain this bill to me. That's their job.
Mhm.
That's their job.
Yeah. So another thing too, any services you get, you may get what they call, this is not a bill. We're just telling you what we did.
And
I
look
see,
at
I
it.
do
Look
get
at
those.
those.
I
So
do get those.
the one thing you don't want to do is panic. And I'm going to tell you why. If I go see Dr. Larice today, and she checks me out, and then say whatever. She runs these diagnostic tests, and my plan says, well, all I can do is pay $30, they're going to pay for the rest. But then all of a sudden, next week, I'm getting a bill. This is not a bill, but I'm getting a bill from that Dr. Larice. I'm like, wait a minute. I'm not supposed to get no bill for no $190. I paid my copay. Now, seniors are notorious. When they get a bill, they start looking for the checkbook. Where the checkbook at? Because I don't want this messing with my credit. I don't want them taking my house. I don't want them doing this. I don't want them to pay this bill. But see, you didn't give it enough time. Because I used to do medical records and medical billing. It takes 90 to 120 days before they have to pay the bill. So while you're paying the bill now, too soon,
And then it gets
they didn't pay it, they get paid. Now try calling them up and say, give me back that $190, I see you paid the bill. You ain't getting it. They call that balanced billing. So I always tell people, don't panic. They ain't gonna take nothing from you. You got at least 120 days. And if so, just tell them to send that back to the insurance company.
Yep.
Here you go, get it. No, they paying. But we sometimes, like I said, we're concerned about our names and our credit and this, that, and so forth. So you kind of will make the move to be proactive. And these companies know that.
And make sure
Okay.
you're looking at those forms well, because when my husband was living, when he got a bill, I would go through them. They charged him for braces for his legs for somebody in Florida.
Oh, wow.
My husband could walk around that table.
Wow.
So I called, and be persistent. I called Medicare. I said, we got a case of fraud here. And they switched me to one person, and they switched me to, it took me 3 people to finally get somebody to report it. But see, Medicare fraud hurts everybody. So make sure what you're getting or what they say you're getting, you're getting. If not, report it. Don't pay them people, because they love getting paid.
And speaking of fraud, This is why they changed this from the Social Security number.
Right.
Because some of you old enough to know, if you had this in the beginning, that A, B, but your Social Security's up there. So if you notice on these cards, there's nowhere to sign them.
Right.
On the old cards, if you didn't sign the back
Get everything.
or the front and you lose it, somebody else finds it, they got your identity. All right, all you have is your date of birth. The rest is history. So they did that, so everything's identifiable to each one of us. And don't be surprised if you get another one back, another one in the mail. They may say, this card has been compromised. We're replacing it with this new one. And that's only for your protection. So in that case, you know, just be aware of that, because that does happen sometimes. And then another thing too, never give this out to anyone. Unless you're changing your plan with a company or a broker or an agent, someone who has to protect your information from violations and fraud.
Yeah.
Because on the phone, if they get this number, I've had them do that too, where I have one of my other clients, a dual person, had everything with Horizon, and she called me and she said, Donald, you're gonna kill me. I said, why? What'd you do now? She said, you won't believe me. I was on the phone, this guy was really good. He said, nothing's gonna change. Because she had all the benefits. She said, well, they go, no, nothing's gonna change, nothing's gonna change. Well, when she went to the doctor with this new card, doctor said, oh no, you gotta pay, I can't cover that. She said, oh my God. So she called me to get her change back. Luckily, because she was on a dual plan, Medicaid and Medicare, I didn't have to wait to hold it. Every month you can change it back. So you're not locked in. And I was able to put her back on her plan. She got her OTC the other day, it was $300. She said, guess what? I'm going down and spend my money. But the point I was making, she said, I gave them this number. Sometimes you can give this information and you don't even have to agree to switch the plan. Somebody who's nefarious,
switch it.
working for these companies, can switch it. Now, if I'm not too articulate on the phone, or I'm having a hard time hearing, I don't have a son or a daughter, or somebody looking after me, my husband or wife, you don't know nothing, they'll try that, hoping that they get away with it. And they generally do, unless you start to complain. Next thing you know, you call the Center for Medicare Services. So these are little things, and I share this with you because this happens all the time. We are very vulnerable, okay, especially when it comes to your health insurance and your Medicare and all that kind of stuff. So just be proactive with it. If you ever have any concerns, you can call the Center for Medicare Services and say, hey, look, somebody called me about this. Is this legit? Or you can contact, you know, your local human health and services or PA Health and Wellness. You can get some information that way as well. If you're savvy on the computer and you got a son or daughter who is, they can look up stuff for you. They can even check if it's a fraud. You know.
And the other thing you can do when somebody calls you and says, "Look, I'm going to get you. Let me tell you about these new Medicare products that you can get." Yeah, the first thing you say is, "Well, wait a minute. Give me your number. I'll give it to my broker. He can call you."
Right. Even if
They'll
you don't
hang
have
right
one.
up. Even if you don't have one, they'll hang right up
You
because
know.
they know they're selling you something fraud.
I've been getting these phone calls and get the person on the phone and say you have Medicare Part A, Part B.
Don't answer.
Then they want you. They want to use zip code.
Correct.
And then they say, but now they offer you a food allowance.
Correct.
Is that for real?
Well, here's the part that
It is
I'm glad
for
you brought
those
that
that
up.
qualify.
So you have to qualify for it. A lot of times, to get that benefit, you got to have at least 2 provable chronic conditions.
Okay.
Number 1. Number 2. Number 3 is that the plan that they may be offering you may not have that as a healthy benefit for that particular plan.
Yeah.
But they'll just switch you anyway. So it is legitimate to some degree, but you want to check first. Call your plan.
I know mine's just a chronic care plan. It is chronic
Okay,
care.
so chronic care plan, so that may be legitimate, but before you sign off with anybody over the phone, I would call whoever your plan
See,
is
I
with.
got a Medicare Advantage plan through Cigna.
Okay,
Okay.
call Cigna.
Call Cigna.
On the back of that card,
I got it.
all right,
Okay.
say, hey, look, I'm getting these calls about, can you give me healthy food? Because
Everything
somebody
sounds
called me
false.
telling me about
That's
that,
false.
okay?
Because a
they'll
lot
tell
of
you.
times it's just
Okay.
a crapshoot for them. They're
I'll
calling
just call.
because out of 25 calls, they might get one.
Yeah, I hang up all the time.
Mhm.
But
I do too.
I don't believe them. I just like,
Well,
they sound too good to be true.
Well, first of all,
it
they
usually
asked me,
is.
"Are you 65?" I said,
and then
"None
one
of your
time the man
business."
asked me, he put everything in and I asked him what was my Medicaid number. I said, I'm not giving you that.
That's correct.
Yeah, never give
That's
you that.
correct. And
Yeah.
another thing that'll get
That's
them
crazy.
is say, by the way, does my doctor take this plan?
Mm-hmm.
Look them up.
Yes.
And they ain't looking them up.
Yourself, yeah.
No.
And you can look them up yourself. What's the name of this plan? Get the name of the plan, call the plan.
Okay.
Say, hey, did my Dr. Jones take this plan? At 101 Broad Street in Philadelphia? Does he take this plan? See, you have to do some due diligence if you're that, how would you say, curious about it. If you're that concerned. But a lot of times, like I said, most of you have a plan that does cover your needs. But if they don't, that's where you look at other
You
things.
start looking at other things. It's shopping. You
Yes,
really
sir.
have to look for stuff.
And, can you explain a little bit better about boutique and private plans? I know that seems to be something that's like of the future. A lot of people say that's what's taking over healthcare.
So say that again?
I'm talking about private and boutique plans. So
Boutique.
more concierge services, concierge plans that go even on top of your normal
Okay.
private plan.
So-
how does that work?
So with the Medicare piece, you can only have one plan at a time.
Not talking about Medicare necessarily, just talking about
The ACE.
some more insurance on top of your insurance. So I know people that have like a Cigna.
Okay.
That's what you will need, but of course you pay for that.
So I call it ancillary additions, like add-ons. In the Affordable Care Act market right now, because that's where you fall in. You're not Medicare. That's Obamacare. Okay. Typically with those plans, they don't give you a lot of extras. You'll get your basics, and like you said, you may want to add on this, add on that, add on that. That may be perfectly okay, but you need to contact your carrier to make sure. Because in the Medicare space, the only things you can really add on are like hospital indemnity, cancer plan, or heart attack. If I get a heart attack, and you can pay extra, dental if it doesn't offer dental, things of that nature. But on the Affordable Care Act side, my advice would be contact your carrier. And if anybody can offer it to you, maybe your carrier can, with the exception of an outside, because you may deal with somebody else and the carrier said, well, we could have gave you that. Or we could have added that to your current policy. I'm not sure if that answers your question entirely.
Well, even if you're not on Obamacare, say you just have normal insurance, you're
Right.
just regular paying,
Paying your premium per month.
Mm-hmm.
Again, my advice is always contact your insurance carrier, because my experience is that each one offers different things for different reasons. One may not, and not to confuse it with the Medicare again, you can't have more than one plan at a time. So if I jumped on another plan when I'm already at a plan, it's going to knock the other one out, with the exception of the ancillary products I can get. Like to give you an example, the medical advantages, if a hospital stay is $200 a day for 5 days, that's $1,000 if I'm there for 5 days. But after the 5th day, it's zeroed out for the rest of the year. I can offer a hospital indemnity plan that may run you $20 a month, and it knocks out that, it gives you 10 days of coverage, so it'll pay that $1,000 from the hospital, because you have a hospital indemnity plan. Same with the cancer, if you're dealing with cancer, heart attack, strokes, things like that. You have money that you can use, almost like, how many of you heard of AFLAC?
Yeah.
From the employer side. AFLAC says, if you get this, we're gonna give you money back. A lump sum. So similar to that. But on the boutique side, I'm not too familiar, and I'll be honest, when it comes to the individual market at all, with how that works with each carrier. So my advice would be to contact them directly, and then ask, you can ask them that question. Especially if you're leaning in that direction, or you need those extra benefits. I hope that helps answer your question, Scott. Just not, too keen on that one. But do we have any other questions? Because you all have been great, by the way. You all have asked some great questions. Yes, sir.
How do we get somebody to handle these things for us if we're not that, actually, if I want to come
Well,
and say, I need to find out, I'm thinking about you. Right
Well,
now.
I
Is that what you
appreciate
do?
that, but both Maurice and I
You
do.
go
I
for
have,
that? So
I have a team.
Here's what I got, here's what I got, what's best for me?
I have a team of
You
agents.
pay,
Yeah.
there's a fee involved.
And we don't charge you
We don't
one
charge you
red
anything.
cent.
No, we just come out
Because
and give you the information.
To make it clearer to you all, we get compensated from each of the carriers, right?
Okay.
But it's
If
the
we-
same.
if we sell it.
It's the same amount. So we're not pushing one plan or the other. So if I get paid $100 for United Healthcare, I'm getting paid $100 for Humana. I'm getting paid $100 for Cigna. And they took that element out so we don't push a plan that pays more, like life insurance. Okay?
Well, we are candidates for you because he's about to retire. I'm on his plan.
Okay, yes. Well, then speaking of the So just to give you an example, they say based on your income, you're getting $500 in advanced premium tax credits. They call them APTC, but it's attached to your taxes. So if Larice had a child, she's going to get what they call a child credit for each child. She don't bend down there.
Coming out of here.
I hear you, sis.
So for each child, you get, say, $3,000. So if you got 3 children, you get $9,000 deducted from your income, so you're not paying taxes on it. It's a credit. They do that with health insurance now, but they're trying to get rid of that